Good morning, good afternoon, good night, doctors from all over the world. My name is Julio Reinafarge. I'm here with DHB Talks. We have this special edition, and we're going to talk about the courses of our DHB done by the Universal School of Health. And I'm very happy to have with me to Dr. John Kriak, who is we're gonna talk a little bit about his course, that it's epidemiology and biostatistics. But before we start, I would like to tell you some exciting news. We have yesterday the launch of our D2D second book from GSI, from Global Summits Institute. This project was led by Emily Lutran, and with John and I, we have the pleasure to have a chapter in that book also. And we have a very nice review from Yahoo Finance, and it's gonna work fine. If you like it, you will find some information on the Global Summits Institute page in Facebook. And you, after this conversation, you can get your CE credits, and you will find the directions to get them on the comments part of the Facebook. So today we're gonna talk a little bit about biostatistics and epidemiology with John. John, thank you very much for being with us today.
Oh, thank you. Thank you for having me. This is an exciting time. There's a lot of good things that are happening around here. So it's a pleasure to be. I'm pleasured it's a pleasure to be part of it all.
Yes, this is a wonderful time for us because we're beginning with this huge project. It's going to be a wonderful way to show people how to enhance their practices and their offices with a DHB, and also get a second DHB. It's a wonderful idea. It's going to give us a different point of view of what we do every day. So tell us, John, how do you decide to study pharma when you began with this traveling all over the world about and talking about your career?
Sure. So it's actually kind of funny how I started. I actually wanted to go to medical school, but so what my original plan was is that I would go to pharmacy school and then have pharmacy be my pre-med degree, so to speak, and then use my pharmacy degree to then go into medical school. So then I would have an MD, RPH. But then as I started to get into it, and as I started to take the courses, I realized that I really liked pharmacy. I liked the, you've got, in some ways, you've got physicians who are a jack of all trades, and, where they understand the diagnosis. But then I realized, whenever I started, back in the, it would have been in the late 90s, going on rounds and rotations and things. And I started seeing how the pharmacists or the PharmD students were part of an integrated care team, where you've got the physician who is leading the team, and then you've got the pharmacist who is going in and helping to make drug recommendations and dosing adjustments based on individual characteristics. And it's kind of also one of the things that helped me to migrate towards DHB, because again, it was, 25 years ago, there was starting to be that integration of healthcare professionals working together. It wasn't each healthcare professional working inside of their own little box. So that's kind of, but back to your original question, once I started getting into it and realizing, that the important role that the PharmD plays in the management and care of patients, and where the physician is going and asking, okay, so Mrs. Jones is here in front of you. She's got these 7 diseases. She's got these, she's on these 10 drugs. What do I do? And then being able to help to make those adjustments and to do those things really that's something that I really found fulfilling, and I was happy to be part of that type of a team. So so that's
Okay.
kind of what changed my course of path.
Mm-hmm. Wonderful. And what do you think? You're used to do a lot of research in your daily work. So what
Mhm.
do you find is the most rewarding part of your everyday's work?
Oh, sure. So right now, I do a number of things, and one of them is, working with a company that is a commercial and research-based genetics laboratory. So, there are a lot of research programs um, that our organization does. Some of which are with small organizations, others are with major health systems. I'm right outside Pittsburgh, but I mean, we're working with organizations that are in Philadelphia. We've got some that are out in San Diego. So we're running these clinical trials, and you know that's kind of what I do on a daily basis. Looking at both the clinical and the research aspects and how to integrate many components into the existing care plans. I mean, the whole idea of what I do essentially is to help to um, um, not only do the clinical aspects relating to some of the testing, such as pharmacogenomics, but also to design the studies that we hope will ultimately improve patient outcomes. And I mean, that's essentially why we're here. I mean, you and I and everyone else in DHB, we are here to help improve the lives of the patients that we treat.
Wonderful, wonderful. And how do you think that biostatistics and in your point of view, biostatistics and epidemiology is going to impact in a doctor who has a small office in Iowa?
Sure.
How
And
do you
and mhm, that is that's an excellent question. So so if if you can take a little bit of a step back here and start thinking about why did we have in school, all of us are medical doctors of some way or another. Why did we have organic chemistry and some of those other courses, those things that that we're like, well, we'll never use this in real life. Why are we doing all of this? And so my initial response to somebody who takes, who's, like my children who are, saying, well, why do I need organic chemistry? Well, organic chemistry and some of those courses you won't use in daily practice, but it helps to lay the foundation to help you to think, and to look for different alternatives. Um, in some of the practices that are out there, there's a set process that has been established, and and it doesn't change. But when you start looking at like chemistry and organic chemistry and some of those types of problems, what you will actually see is that there is a pretty much an unlimited number of examples in which you can have, which kind of along the same lines is the patient that shows up in front of you. you know
Mhm.
um, each of us on any given day will have any number of patients showing up in front of us. Each one of those patients are unique. So the bridge between organic chemistry and that patient is that a long time ago we learned how to begin to think about doing things or looking at the problem in front of us and applying the principles that we've learned. Okay, now that's organic chemistry. This is epidemiology and biostatistics. Okay, um, there is a little of the same principle here, and that is that it helps us to think in the same way that I had mentioned. However, however, um, with that being said, you know the epidemiology, understanding what the courses and then what's covered in the courses, and the role that each of them plays in public health. And if
Mhm.
you can go broad in understanding the public health aspects, you can then narrow it down into, the individual patients in front of you. So going back to the original question, okay, so how does epidemiology and biostatistics come in? Now that I've given my background and, everybody can understand how I'm thinking, the on any given day, as healthcare professionals, we will receive any number of journal articles, or we will receive, there will be advertisements for new medications, or we will read about a new procedure, or whatever else that might be. And the question becomes, is that after reading, or being able to read and understand that article in front of you, the healthcare provider has to be able to make a decision on whether or not um, they are going to incorporate that treatment measure into their arsenal of treatments, whether it be a procedure or whether or not it be a new medication. Um, you know, in every professional journal article, if you go onto PubMed, and you go into and you break it down, and you take a look at the background information. Well, the background information contains a lot of epidemiology. Why are you performing this particular study? And then, so, to give, and then the introduction will talk a lot about, the prevalence and the incidence and prevalence of this particular disorder, and why this study should have been performed. And then once getting down into called statistical method, there is if you don't understand basic statistics and you don't understand what that means, you won't be able to appropriately evaluate that particular article that is there in front of you. So whenever they're talking about confidence intervals and p-values and the different types of tests that were performed, whenever I read an article about something, I'm able to go through and critically evaluate the relevance of that article with respect to the question at hand. Does it apply? Same thing can be applied for the patient in front of you. So, for example, I know, like, with DHB, we've got a lot of dentists, okay, and there are, and we've also got some of those dentists out there that have got patents for new devices, and who are innovators in the field, who may be performing new procedures. Having that type of a background to understand, okay, well, all right, well, I'm going to want to perform a clinical trial to prove that, I think that the procedure that I'm doing is well. I've seen good results in my patients. You know what? I think this could benefit a lot of other people. So um, with all of that in mind, the 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 epidemiology and biostatistics is one of the foundational courses for pretty much all healthcare providers, to, number one, to be able to understand what other providers and what other healthcare folks are presenting in the articles, and for you to be able to critically assess that, to determine whether or not you believe that it's good for your patients or not. And number two, for those of you that are thinking of considering going into research, well, of course, you're going to need to understand epidemiology and biostatistics. Now, in many research studies, of course, you're going to hire a statistician to do that, but you probably should be able to understand what it is that that person is saying. And like I said, this is one of the core courses. Will you be asked to calculate prevalence in your daily practice? Probably not. There probably wouldn't be a need to, but you should know the terms and the principles whenever you are assessing something in front of you.
Yes, because right now, in the times that we're living right now with this pandemic, what we're having is the biggest example of how to apply biostatistics and epidemiology, because we have to know for every day's work what is going on with this disease.
Hmm.
So this is the biggest example of how to apply how to biostatistics and epidemiology also. So also when you mentioned something that it was going on, it's very important, is that we are going to have many people who are innovators, who are entrepreneurs. So for these entrepreneurs, how important is to know a little bit about biostatistics and epidemiology in there. We're talking about a business, we're talking about new things and how it's going to impact biostatistics on the kind of work they are planning to do.
Absolutely. Okay. So let's start with epidemiology. So
Mm-hmm.
you've got, so we have a lot of innovators that are out there. And so if there's an innovator and they are doing this to help a large number of people, it would be understanding epidemiology, essentially in this, what's it called? As it is the condition or the process that they're trying to incorporate, how well will it be used? You know, um, so like for example, if it is, maybe they want to do something for a rare condition, but if they're looking at doing something with a rare condition, you know, understanding that, that okay, so maybe this process might help one out of 50,000 patients that I see in front of me. Yeah, that's a good idea, but I'm trying to I'm trying to feed my family. Okay. And if you might see two or three patients like that throughout the course of your career, for example, that might, y- but and obviously you can glean from that information. But from an epidemiological standpoint, you know, um, you're looking at being able to, a lot of it goes back to interpreting the data,
Mm-hmm.
interpreting the information as it comes in. Whenever I say that it's a rare condition and that, now maybe it's a rare condition around the world, but it might not be in the local province that you're in. We have doctors from all over the world,
Mm-hmm.
and folks that we are working with. For example, there may be a rare condition, but um, in a certain area in Peru, it's pretty prevalent. Okay, well, that's something to be able to know and to understand. And what does that mean? From the biostatistics, again, going back to some of my earlier statements, and that is being able to um, assess and interpret whether the procedure or what you're looking at, obviously each person. So an innovator has an idea. Sorry, let me take a half a step back there. So
Mm-hmm.
there's an innovator that has an idea, okay? And then the innovator says, I want to incorporate this new process, this new procedure, this new combination of drugs, okay?
Mm-hmm.
Um, and then, oh wait, this person got better. Okay. So then you start, because as a doctor, you're able to do that. Um, and one of the things, my one of my mentors, okay, has always said that that being a doctor allows you to be in the practice of medicine. Okay. And the reason why they call it the practice of medicine is because you're essentially practicing on that person in front of you. Okay. You are going to choose a treatment that you believe is going to work in that patient, but in all actuality, um, that patient um, may be unique and it may not work. So, sorry, I digressed there a little bit, but so, back to the innovator who has this wonderful idea. The From a biostatistical standpoint, it's okay. Well, did the patient in front of me, or the 10 patients that I treated, did they get better because I did something innovative? Did this occur by chance? Or did this actually occur because of the fact that this is a phenomenal new treatment. So basically, from a statistical standpoint, you help to, and I'm going to make up a word here. Well, one of my colleagues uses it, but you help to uh, uh, distinguish between fantastical, okay, versus phenomenal. And that's
Okay.
one of the things, and understanding and understanding what it is that you're doing. And like I said, from a from a statistics and epidemiology standpoint, this is the foundation on which many other components of your practice and of your studies will be built, because it helps you to think and to critically evaluate the data that is coming in. And let me
Yeah. Mm-hmm.
okay. So let me go back and just repeat that one part again. Critically evaluate. And that is because, again, if say you're an innovator and you're reading information about an innovator, about another innovator, and you're reading the report that they have presented in front of you, you're going to have to determine, did that treatment really help the patient, or was it chance that the patient got better? Was there some other underlying factor that caused the patient to get better? Or that the procedure that you performed was a success, and your treatment really had nothing to do with it all. Now we're talking about statistics, and now we're getting into, whether you're looking at the hypothesis and the null hypothesis and p-values, and then you get into statistical power in the sense that, well, you know what, maybe 5 out of 5 people got better, but that's not big enough to determine, to actually prove that what it is that you are performing did what it was supposed to do. And that's where the power comes in, and understanding all of those things. I think one of my favorite examples of where biostatistics may be misinterpreted is if you go on any TV commercial. 4 out of 5 dentists surveyed. Okay, well, that really says nothing. Okay, how many dentists? How many dentists were surveyed? What was the survey? And I could go on and on and on with the types of questions. Okay, they might have surveyed 5 dentists. Okay, and so 4 out of 5 dentists surveyed. Okay, so I mean, those are examples of poor examples. So that's an example of a very poor um, type of not even a study. I mean, it's a survey, and being able to understand that a survey really doesn't mean anything because that's an opinion. And then, and then once we start getting into all of that, then we start talking about levels of evidence. Okay, where, if you think of levels of evidence in the form of a triangle, and down at the bottom is expert opinion. Okay, well, Dr. Giulio, I mean, you and I could be considered experts, and we have an opinion. That doesn't mean a lot, but at the very top of that very triangle is going to be, whether it be a GWAS or, a randomized controlled clinical trial, or things that have a higher level of evidence where it's been proven. You and I may have an example that of what we're doing is fantastic. But then if there's a randomized controlled clinical trial to prove that, then that's a higher level of evidence, and people can be, and then our colleagues can be assured that what it is that we're doing is wonderful. So there's a very large stretch between 4 out of 5 dentists surveyed, okay, and a randomized controlled clinical trial, or even a group of them known as a systematic review. Sorry, I digress. I get a little excited about this, even though it's just biostatistics and epidemiology, which is, something that, I'm hoping to impart, that's, if there's 2 courses to not really get excited about, biostatistics is definitely one of them. I mean, that's like, getting people to want to take that course is kind of like organic chemistry. I mean, literally pulling teeth. So.
Uh-huh. Okay. So no, it's pretty interesting because it depends if you choose a course, maybe many people think, oh, I'm gonna take it biostatistics, I'm gonna take epidemiology. Oh, wow, but it's the way you see it and the way how it's gonna improve your everyday practice and how it's gonna impact your work and the way you're gonna see it. Because epidemiology is gonna see if you wanna translate it to you're living and the place where you have your practice. It's like knowing about all the people who lives around you. And biostatistics is gonna prove how you're gonna in all these people and how you're gonna work better for these people, and if what you are doing is doing good for all the people that you have around you. So it's a wonderful point of view, and I love it. I really love it. So what do you think, and what is your how you are planning to show it in the DHB, how you're gonna move on your course, and how you plan to insert this part and to show all the people the how to work with biostatistics and epidemiology in your course in the DHB.
Oh, that's a wonderful question. So, my wife, who is a very smart person, and she's definitely smarter than me because for some reason she's always right. But so, but my wife has a saying that I have adopted that I really like, and that is perception is reality. Okay, and you know, um, if if students in general or learners in general think biostatistics, that is a horrible course. I hate it. I'm not going to learn anything from it. Well, perception is reality. They're going to they're going to go in and thinking that, and they're going to come out thinking that as well. Oh, that was horrible. I would rather have a root canal. I would rather have 6 root canals than take that course. Or it is, okay, so the understanding, yes, the material can be a little dry. Okay. However, it's working towards the end point. It's not, yes, the material, there's nothing there is nothing exciting about, reading and learning about it. However, if you understand what it is that you're working for, then that is what makes the learning process that much better. So, for example, going through and, starting off by talking about or introducing the concepts of what will you get? What will you ultimately, what will you have when you complete the course? And again, a lot of some of the things, a lot of what I just talked about, you know, um, and having people understand that, okay, you know what, I need this to help me practice better because it will help me interpret data, interpret articles, evaluate treatment measures, um, evaluate different types of surgical procedures that much better, and be able to critically do that because I understand what it is uh, that I'm looking at when I'm reading this data in front of me.
Mhm.
That is one of the measures that will be used. The other is um, practice makes perfect. Okay, um, lots of problems, but lots of real world problems. Okay, and it's being able to take a look at, and the real world problems will often change. Not going to be something, for example. Um, if there's a group of dentists that are taking it, me doing some real world problems on statistics in the auto industry isn't going to provide anybody any benefit, right? Because then they're not going to see what it is that they're working with. So being able to, show practical examples as to how the principles are applied, I think is, one of the most important things. So again, perception is reality.
Mhm.
Understanding it is dry material, but once you've mastered those principles, understand what is going on in the particular area, how can it be applied in the real world? Um,
Mhm.
and that's one of the things. And then also, in any type of teaching of of the course will be you know, um, a skills on critically interpreting the medical literature. Evaluating the medical literature is part of it all, because again, part one, understanding the basics of epidemiology and biostatistics. Part two is getting into the practical examples of epidemiology and biostatistics. Part three is your critical application of that with real world articles that have been published in PubMed. And there's plenty of examples of those that are well written and plenty of examples of those that are not so well written.
Mhm.
And then being able to identify those, because that's where there's a lot of that is where I think that a lot of people will really begin to appreciate the value um, of these courses.
Okay, wonderful, wonderful. Because it's gonna make it's like um, when we're talking about biostatistics and everything, it's gonna make sense of your everyday's work. It's gonna make sense every day, and it's gonna make sense in your business. It's gonna make sense in your everyday's practice. So yeah, I think it's wonderful and wonderful. And when we're talking about the DHB, and what do you think how it's gonna how it's biostatistics and epidemiology is gonna work with other research areas? So how do you think that we're gonna merge this with other areas in research and innovation?
No, sure. So again, going back to some of the earlier statements, it is the foundation on which um, it is the foundation on which understanding the data and interpreting the information that comes in. Now,
Mhm.
with DHB, you're looking at an interdisciplinary approach to
Yes.
treatment of healthcare.
Mhm.
So, you've got a dentist, you've got a PharmD, you've got an MD. Um, you have maybe a chiropractor,
Mhm.
and some of the other folks that are there. Philosophy. Well, again, it's the same thing. You know, um, a dentist cannot do to the same degree what a medical surgeon can do, and vice versa. And so, but as you're beginning to work with an approach and you're taking an approach on a team, and you start to go back to the um, interdisciplinary um, care team approach. Whenever I first started and I was on rotations, you
Mhm.
know, um, but now that's expanded out there. You know, Mrs. Jones may be seeing a multitude of doctors. You've got your cardiologist. You're going to have, she goes to a chiropractor. She also has poor dentition, and so she's working with a whole group of people. But being able to understand, um, you know, how to work within the groups, you're going to have the basic skills to be able to interpret um, the the information and the findings that are out there, with the colleagues.
So it's very important to know that epidemiology and biostatistics is going to work with with all kind of doctors, and it's going to integrate many of the information that we're going to have. As they usually said in Silicon Valley, everything is data. So
Yes,
what we are going to have is data that it's going to work with many of the different areas that we're going to have in healthcare. So I think and that. we are going to have something. It's a point of reunion of all the specialties and everything, every part of even I don't know, even the every information that we are going to have is going to work fine for everyone over there.
Mm-hmm.
So it's gonna be it's like an integration point. It's gonna be the merging point where we are gonna work in that on the DHB. It's wonderful, wonderful
Mm-hmm.
idea. So, and what do you expect about your students in the DHB?
So, well, number one, obviously, we will all be working together as professionals. So, yes, they will be students, but on the other hand, they will also be colleagues,
Yeah.
because, there is it's one thing to be in a traditional university setting where there is the professor and then there is the student. But again, with DHB, it is the integration of colleagues. And my opinion on it, and my approach with DHB, is that we're all colleagues. We're all working together. We are imparting knowledge on these, on some of our, well, we can loosely use the term students, but they're essentially colleagues. So I expect nothing less from them than they expect from me.
Okay. Wonderful, wonderful. It's gonna be. It's like many people thinking about how to their everyone's practice and everyone's work in healthcare. So it's like talking a little bit of the point of views that we're gonna have everywhere around the world, because we're gonna have students from all over the world. So it's gonna be a very interesting way to see it. So I think it's gonna work fine. So we this course, and you are gonna work with any other areas. You're gonna have a link with any other areas. What could you could tell us about? You're working in genomics, so you're working on in your everyday's work. So what do you think about genomics and how it's going to impact with many of the students that we are going to have over here? Because we have to have a role model. So you are working with research, how it's impacting in your research every day, the kind of courses you're gonna give to our students, how
Sure.
it's gonna. It, let's do it like an example of how you're working with genomics and with biostatistics epidemiology.
So, so again, at the beginning of at the beginning of the podcast, I talked a lot about, um, you know, some of my views on biostatistics. But essentially, what it is that I'm doing is, I'm working with a team of professionals, and we are critically evaluating the data that comes in is number one. But that's way down the steps. I mean, because the first thing is being able to design that study, to be able to look at a patient population, determine that there is a need for doing the study, and then walking through the process. Um, so, you know, whether it be genomics, or whether it be surgery, or whether it be a um, repurposing of an existing medication. You
Mm-hmm.
know, for example, I mean, you've got some older antihypertensive medications that are used to treat PTSD patients.
Mm-hmm.
To help them sleep. And I can go on and on and on with examples on how that on different medications. But where did that come from? Why is it that, giving that one example, where an older antihypertensive medication is given to PTS patients to help them with nightmares? Where did that come from? How did it get from, there was an idea, there's that idea from a patient, and maybe it was, some folks that Maybe they were overseas, involved in conflict. They were in the military, or maybe they were victims of some horrible crashes, or maybe they were, abuse, whatever it is. But how did it get there? How does it get that it's now published in the medical literature that this may be beneficial? Um, so, then so there's that component. Now, there's also the component of genomics, and how does that play? You asked me specifically about genomics, and the same thing is, how do we get to the point from saying, okay, by looking at a patient's individual genetic profile, seeing that something, it looks like it makes sense, but then actually changing the way that we treat medicine.
Yes.
And so, for example, there's a number of companies at which you can order genetic tests from. Are they applicable in dentistry? Maybe. Are they applicable in medicine? Absolutely. Because it's, and the reason why I said that with dentistry is because in many instances, the patients aren't going to be on medications long enough to actually have, an impact. However, some of the antibiotics that might be used, you know, but anyways, I digressed a little bit. But so, um, you know, from the genetic standpoint, does a healthcare provider want to incorporate genetics in there? And a lot of it is going to, take a look at, okay, so there's the genetic test that comes in front of you. Some of the information is clinical, some of the information is classified as being informational. Well, what's the difference between the two? And the difference between the two is the level of evidence, that occurs. And, I think that, understanding how to critically evaluate, number one, an article to determine its level of evidence, as opposed to having somebody tell you what the level of evidence is. That's something that you've got to decide. You've got to be able to, you read an article that there's this, like, for example, let's just say that it hasn't come up yet. But going back to my original example, you read an article that using an older antihypertensive is effective to help PTSD patients sleep to not have nightmares.
Mhm.
That's interesting. Okay. Or it starts off as a case report. Okay. And then all of a sudden now you read about it. Oh, that's interesting. But I don't know at that point that I'm actually going to start prescribing this medication to my patients. That's how this started. And the same thing is moving forward with those that are the innovators in the group. There is a case report. Um, as a dentist or a doctor, I was, I tried. I had a patient with these characteristics. Here is what I did, and here is the outcome. Okay, that's a case report. Okay, now we move up to a case series. Okay, well, you know what? This is interesting. So I'm going to keep moving on down the line. Okay, so now I'm going to start doing it in more and more patients. All right, well, I've now done this in 10 patients, and I've had fantastic results. Okay, at what point does that innovator then reach out to someone else to help them to actually perform a study? You know,
Mhm.
that's a very important component for the innovators of the group. Of being able to determine whether or not what it is that they did um, occurred because the treatment was successful and did not occur by chance. They didn't get better by chance.
Mhm.
So, I think that's those are just a couple of examples.
Yeah, that's wonderful because even if you have a very customized treatment for any disease, you can also could apply your biostatistics and your epidemiology also, because it not depends on how do you do your treatment. It depends on how it's going to impact in the whole society, and it's like public health and everything. John, I think it is was a wonderful time that we had together in this DHB talk, and I'm very interested in your course. I'm very enthusiastic with your course also, and I hope that when we begin, it's going to be one of our main, it's going to define all the main trends that we are going to do in our DHB. Thank you very much for being with us today.
Oh, thank you. Take care.
Thank you very much. And thank you to all of you guys. I would like to, if you have your CE credits, you're gonna find it in the comment part on the Facebook. And thank you very much. It was a wonderful conversation with Jon. I'm waiting a lot for all these wonderful courses that we're gonna have on the DHB, and I think that this is gonna change the way you see your profession and your clinical work and your life. So it's very to you. Please sign up with us on the DHB. We're waiting for you. And Jon, thank you very much. Wonderful to talk to you again. And
Wonderful.
we will
Yes.
see you soon.
Yep. Thank you.
Okay. Bye
Okay.
bye.
Bye bye.